Now, the Pan American Health Organization, PAHO, is warning Caribbean countries not to depend solely on COVID-19 testing of incoming passengers when borders are reopened. PAHO's director of its Health Emergencies Department, Dr. Ciro Ugarte, says he understands that these tourism nations are dependent on travelers, but noted that testing alone could generate a false sense of security. He points out that there could be factors involved after a person is tested for COVID-19, and if a negative test returns, it could prove to be a false negative. This is why he is urging Caribbean countries especially not to let their guard down.
When it departs from measures that the community thinks that are protective, the community feels that they are secure when the incoming travelers have been tested, but that is a false sense of security and are not cost effective.
Meanwhile, Mr. Ugarte says a mandatory quarantine period for incoming passengers to tourism-dependent countries could prove to be a deterrent for travelers. He says countries needed to figure out their balance as it relates to quarantine and testing, but suggests continued monitoring of incoming passengers.
And the advice that we have especially offered to the government of Barbados is to consider focusing on efforts on monitoring the health status of incoming tourists for the first 14 days of their stay, and to consider doing so in partnership and in great collaboration with the tourists themselves, but also with the hotels and the tourism industry at large.
Now, speaking at a press conference on Wednesday, the PAHO director said there will always be a risk when a country considers opening its borders, but it is up to the country's management of COVID-19 that will ultimately determine the success of tourism in the post-COVID era.